All right, so next part we have the implementation, which is how do we get the job done? Now remember the Perry approach, implementation comes after recommendations. And ideally we base our implementation on strong recommendations as they provide the foundation for what we choose to implement. So today we often have many intervention options with adequate data. So it's about choosing the right ones. Most interventions will have both potential benefits and harms. So a cost-benefit analysis is crucial. So given the variety of options, there needs to be a systematic approach to deciding which interventions to use and combine for the most effective and efficient results. Now, this is where the who, when, how approach comes into play. So when often asks about the timing. At what point in the disease process should the intervention occur? Timing can greatly impact the success of the intervention. Then for who, this considers essentially who should receive the intervention, who are the target populations, and how do we prioritize them. Then third is how, which focuses on how the intervention should be implemented. What methods, strategies, or systems will be used to deliver the intervention effectively. All right, so now when we're talking about when to engage in an intervention, there are three categories to describe the timing of an intervention. First, we have our primary interventions. These occur before the onset of disease and aim to prevent the disease from occurring in the first place. Secondary interventions are next. So these take place after the disease has developed before symptoms appear. The goal is early detection or reducing risk factors in asymptomatic individuals. So an example of this could be screening for breast cancer. Then we have tertiary interventions. These occur after symptoms have developed, but before the disease causes irreversible disability. The aim is to reduce the impact of the disease and prevent complications, managing advanced cancer to prevent further deterioration. So more highlighting on the cancer example. So say you saw a video saying titled Eating to Starve Cancer, and it listed foods that have antigenic effects, which limit the supply of nutrients to potential cancer cells. So we change our diet accordingly to decrease the chance of developing cancer in the first place. So that right there could be an example of primary intervention. The next part is say you go and get a mammogram and then see that, well, now you have cancer, so now you have to change some lifestyle factors, so quitting smoking, decreasing alcohol consumption, etc., etc. So that right there is more secondary. And then tertiary, we have chemotherapy. So you already got the symptoms going. Now you're just trying to basically minimize the damage, ideally. Right, now, so for who, we're focusing on who should we target with the intervention. First, we have our individual level interventions. Sometimes it's best to direct interventions to individuals, especially as part of clinical care. So example could be treating a patient for hypertension or providing personalized smoking cessation programs. Then we have our group level interventions. Since other times, these may be more effective when directed towards specific groups, particularly a vulnerable population. This could include targeting at-risk groups for diseases like diabetes or mental health issues. Then there's population level interventions. In some cases, it may be necessary to direct interventions towards the entire population. So examples could be broad public health initiatives like anti-smoking campaigns or climate health policies that address environmental factors affecting everyone. Some more an idea on the climate, air, and health example. At the individual level, you have treating individuals with chronic obstructive pulmonary disorder, or COPD, that they develop from living in a city and breathing in all those pollutants. At a group level, you have advocating for policy changes for heavily polluted areas. And at a population level, you have promoting active or public transportation options and educating residents about air pollution mitigation practices. Right. Finally, how do we implement the intervention once we know who we're targeting and when? And so when we're addressing the need for behavior change, these are the three basic types of the strategies. First, we have information, which takes an educational approach, which aims to change behavior through the delivery of information. It can be delivered through individual encounters, group interactions, or social and mass media. Our next one is motivation, which focuses more on incentives. So, which means tangible rewards and penalties to encourage behavior changes. Of course, this is more than just encouragement, it's about offering real incentives for adopting or maintaining certain behaviors. Then finally, we have an obligation, which are your requirements. This approach relies on laws and regulations that mandate specific behaviors. So an example of these could be smoking bans in public places, and also some other examples, say for, of course, the information. So we have information about the negative consequences of smoking, and then maybe an idea of an incentive could be a high taxes on cigarettes. So those are examples. All right, so now on this slide, it's listing 9 different options to help us better understand how we can address cigarette smoking through various strategies, just for an example. Now, deciding when, who, and how to intervene is based on the available options, and the evidence that supports the intervention's effectiveness, along with societal attitudes towards different types of interventions. So for one thing to note is US society often leans towards informational/educational strategies because they are the least likely to infringe on personal freedom, which we value highly. So one approach could be using mass social media campaigns. These can be tailored to different groups, ensuring that each message is presented in a way that resonates with specific audiences. But and this also helps avoid ad fatigue, since no one likes seeing the same ad over and over. However, motivation-based strategies like taxation can be highly effective. For instance, increased taxes on cigarettes can create a financial incentive to quit. And of course, we still have our obligation-based strategies, which are actually probably the most effective, especially when there's clearly defined behavior and easy enforcement, like banning indoor smoking. But these should generally be used as a last resort, as they limit a freedom of choice and can be expensive or invasive to enforce. Think of the Prohibition era, for example. All right, so we have evaluation, which is to see how do we know our interventions worked. We know that very few interventions completely solve a problem in a fell swoop. Even if an intervention exceeds expectations, there's always room for improvement or adjustments to address any unintended consequences. So how can you evaluate the results effectively? So to answer that, we have the RE-AIM, which offers a comprehensive framework for evaluating interventions in real-world settings. This approach is gaining popularity because it not only looks at whether the intervention works, or the RE portion, but also whether it's sustainable and acceptable over time. RE-AIM stands for reach, effectiveness, adoption, implementation, and maintenance. So now we're going to go in depth on each piece. First off, who are we reaching? Who is the intervention designed for, and how well does it reach that target group? This dimension looks at the potential of the intervention to reach the people it's intended for, and even those who may not have been initially considered. It's about assessing the scope of the intervention's impact. So an example of this is if an intervention is aimed at reducing obesity in children, how many children in the target community are actually participating? Are other age groups or underserved groups participating as well? Then there's effectiveness, which is what is the actual effect on the target population and does it work as intended? This is where we assess the outcomes of the intervention. Are the goals being met? Are the positive changes sustainable? And what kind of adverse effects, if any, might we see? So example is after implementing the obesity intervention, are children losing weight or improving their eating habits? And if there are any unintended side effects, such as stigmatization or lack of engagement, and then how do we address them? Then adoption, how well is the intervention accepted by both the individuals it's intended for and the service providers or organizations implementing it? This looks at the initial buy-in. Are the people who are supposed to deliver the intervention, such as healthcare workers or teachers in this case, and the recipients, patients or students, accepting it? If the adoption rates are low, we need to understand why. So an example of this could be, are schools willing to implement a new physical activity program? Do parents support it? And is the community ready to participate? Then we have implementation. How is the intervention being delivered and can it be improved? It means here we must examine how the intervention is being implemented. This includes looking at whether the program is being carried out as planned and whether any adjustments need to be made to improve its effectiveness. So back to another example, is a new physical activity program being delivered consistently across schools, or are there differences in how it's implemented based on school resources or staff knowledge? And do we also need to adjust the program to make it more feasible? Finally, we have maintenance. How do we ensure an intervention continues to work and is sustained over time? It's not enough for an intervention to work in the short term. We need to know how to maintain its effectiveness over the long term, both for individuals and for the organizations or communities delivering it. Back to the example again. If physical activity program is successful, how do we make sure it continues after the initial phase? Is there a plan for long-term funding, training, or community support? So in short, the re-aim framework is critical because it helps us look at the big picture, how the intervention works not just in controlled settings, but in real-world practice. By evaluating reach, effectiveness, adoption, implementation, and maintenance, we can assess both the short-term impact, long-term sustainability of interventions. This is essential because in public health and many other areas, we need solutions that are not just effective, but also feasible, adaptable, and sustainable. All right, so in order to wrap things up, the Perry approach is a simple but powerful framework that summarizes the key steps in public health practice. It highlights that we need to do more than just identify a health problem. We need to understand its underlying causes, and this deeper understanding helps us create more effective solutions. This also helps structure the use of evidence to make informed recommendations. And finally, the circular nature of the Perry cycle reminds us that the improving public health is a continuous process. We don't stop after one intervention, we keep evaluating, adjusting, and refining our approach to make health improvements sustainable over time. And that is the end of this lecture. Thank you for your time.